Hello everyone, welcome to Voice of Homoeopathy. This is the third part of the syndrome series. Now we have Brown-Siegert syndrome. Now Brown-Siegert syndrome is basically the damage to the spinal cord. The one side of the spinal cord, maybe by some lesion or some injury, and what it causes is paralysis of the and loss of proprioception of the same side of the lesion, and loss of temperature and pain sensation on the opposite side of the lesion. Well, when you have to search, you can go in the generalities. We have Brown-Siegert syndrome here. Some of the medicines are there: the atropine sulf, belladonna, cocculus, ergotin, calibrom, naxomica, sikel, and strychninum. You have to focus here on the ammonium brome is also there, and you have to focus here on the ergotin and atropine sulf and strychninum. You can also see this rubric in the back injuries to the spine under this heading, and you can see in the paralysis of one side under this heading also, and you can see paralysis accompanied by sensitive nerve skin. We have plumber mat here. So this is the way to search, this is the way to study. And paralysis after injury, you can think of arnica here also. Okay, so now we have chronic fatigue syndrome. Now in chronic fatigue syndrome, basically it is a condition of long-term fatigue which disallows a patient to carry out his daily activities. Now to see the chronic fatigue syndrome, you have to search in the generalities. Chronic fatigue syndrome, we have many medicines there, rare and polycrest, like muriatic acid, natramur, phosphorus, like rare ones like ozone, penicillinum, sacrolactic acid, and you can also see under the heading weakness, slight exertion, and under the heading of weariness. Now we have Cushing syndrome. Now Cushing syndrome is basically the tumor of the pituitary gland, and which leads into the excessive production of ACTH hormone, and which further leads to produce the adrenal gland high levels of cortisol. Now the two main medicines we have seen in this condition are corticotropin and cortisone. These have very good results in Cushing syndrome. And next we have Down syndrome. We all know that Down syndrome is basically the abnormality of chromosome 21, which what happens is the physical and mental growth of the patient delays by the age, and he looks at the age of 20, but his mind is maybe of a 2 or 3 year child, and which have intellectual disability, and some characteristic stupid facial expressions are also there. So the main medicines we have seen I have personally seen carcinosin, very good result in the Down syndrome, and Morgan Patterson, pertussinum, and toxoplasmosis gondii. Now we have Guillain-Barré syndrome. What happens in the Guillain-Barré is it is a disorder of the immune system, or an autoimmune disorder, in which it damages its own peripheral nervous system. The initial changes are some abnormal sensations, some muscle weakness, fatigue in specific parts, tinglings, and some types of loss of movement type of sensation. Basically it's a slow type of paralysis, and muscle weakness increases so much it occurs from the hands and feet and spreads to the whole body and make the person bedridden, maybe in some cases fatal also. So in Guillain-Barré syndrome, you just need to search in the generality section, Guillain-Barré syndrome. You have medicines like aconitine, Illumina, Arenia ixabola, and also have medicine semicifuga, conium, lycinum, mandragora, mephitis, plumum, and a rare medicine psilocybe. Now, psilocybe, I want to tell you, in North India there is a concept of naval dislocation or umbilical artery dislocation. We also know in this there is a name in the Hindi, dharan जिसको बोलते हैं. So it basically occurs from the overlifting mainly, includes some symptoms like colic, vomiting and diarrhea. So psilocybe is a very good medicine for that condition.